things are changing, so the profession is progressing, but I think implementation is very, very important. So we should make sure that we provide contemporary care to our patients, and to do so, educational programs are very, very important. Education programs have a very important role in making sure that they teach contemporary care, and then of course there's also a role for the clinician to implement it in clinical practice.
On today's episode, we're excited to speak with a leader in manual therapy, Dr. Nathan Hudding, a physical therapist, associate professor at Haan University of Applied Sciences in the Netherlands, and vice president of IFOMPT. Nathan has dedicated his career to advancing both clinical practice and research, with a strong focus on the safety of cervical spine treatments and the promotion of person-centered care in manual therapy. Today, we'll explore the intersection of clinical safety and patient-centered approaches in manual therapy. We'll dive deep into his role with IFOMPT and discuss how the field can continue to evolve to meet the needs of both clinicians and patients worldwide. Nathan, thanks so much for sitting down with us. We appreciate it.
Hi, nice for inviting. Thank you for inviting me.
Yeah. So you just walked off stage here at IFOMPT 2024. A lot of people asking you some really, really great questions. Good energy from the people who are coming up after you walked off stage?
Yes, I think it's very important that people have questions and would like to interact with you. If people don't come to you after your presentation, maybe I also think maybe I did something wrong.
Maybe it's a bad sign.
Yeah,
right.
So.
Yeah. In the digital world, it's easy to reach out, but there's something different in the way that you do it while you're at a conference, which is this human thing that we're sort of designed to be able to interact with.
I think that's one of the biggest advantages of conferences, that you can interact with the speakers, easy accessible, so you can ask those questions and pick their brains, and I think that's very very valuable for attendees.
It's exciting. Perfect. So you've been a keynote speaker on the topic of safety in cervical spine treatment, which is a critical issue in manual therapy. Help me understand. Can you explain why safety is such a key concern and how clinicians can best navigate those challenges in practice?
Yeah, so the title of the presentation was Safety First, so because I think that's very important. And of course, people are always interested in new techniques in manual therapy, and it is also very important because we need to treat patients, so we need some techniques to treat those patients. But on the other hand, safety is very important.
Sure.
And of course, safety incidents, serious adverse events are very, very rare. So the focus of the presentation was in the cervical spine, because we know that there can be some vascular serious adverse events happening after treatments, for example. So that is very important that if we treat patients, we do it on a safe manner. And although it's not really a sexy subject, I think every manual therapist, every physiotherapist should be aware of those risks and how we can avoid that people will have a serious adverse events after your treatment. So I think it's a very important topic. Although, as I said before, luckily these events are very, very, very rare.
Yeah. How was it received? What were some of the questions you were getting after that?
Yeah, I think it was received well. So I think one of the good things I think is that I started with a kind of polling. So I just got the opinions of the audience, and then in the presentation I showed them their results, and then you also really see that there is some room for improvement also in this audience, but we also know that from scientific literature there is some room for improvement with regard to the knowledge and skills of manual and also physical therapists, and then also people really they hear what you say because they just voted and they just give their opinions, and maybe their opinions were wrong, and that maybe can can be important for them. Maybe I need some additional knowledge, for example.
Yeah.
So I think it was well received.
Yeah. Person-centered care is another important issue of your work. How do you integrate this approach into your practice and teaching, and why is it essential in manual therapy settings?
Yeah, so I think that if you look at person-centered care, it really relates to a biopsychosocial approach and self-management. So I combine these three topics because these are really related to each other. And I think all the treatment we provide, it is focused on the person. It's about the person, of course. And that is very important, that we have that conversation with the person, that we involve the person in the decision-making process, that we involve them in a goal setting, that we make sure that the treatment is individualized to that individual. And that's not only important for physical therapists in general, but also in manual therapy.
Sure.
So I believe that, and because one of the topics I'm very interested in and also present a little bit on tomorrow is a self-management approach. And some people then say, hey, you are a manual therapist, self-management. How,
Right.
how is that possible? But I do think that such an approach is also important for manual therapists. So to make sure that the patients have the skills to lead their care, to be involved in their care, and to have a huge influence on their care. And then they need those kind of self-management skills. And also in manual therapy, we should support people have a leading role in their care.
It sounds like you're saying you're not only manual therapy. Manual therapy is a part of how you provide care, not all of how you provide care. Do I have that right?
Yeah, so I think that it is a component, and basically, from my perspective, I think it can be an important component, but not in all patients. So some people don't need manual therapy; they can need exercise, or they need other approaches, or just only need some support with regard to self-management, some education. But I think a combination of approaches, I think that is the way to go, and that is dependent on the patient how much manual therapy is needed. Maybe a little bit, maybe some more manual therapy, but I do think that education, exercise, and self-management support are always very important components in such an approach.
Yeah. As a physical therapist, researcher, associate professor, you balance many roles. Those things are vastly different, right? How does your clinical work inform your research and teaching, and how do you stay grounded in patient care while leading academic initiatives? It feels like they're spinning three different plates. How do you keep that all together?
Yes, I think it's also an advantage, because sometimes you see those researchers who are not active in practice anymore, so they're not really working as clinicians anymore, and that can be difficult because I think it's important not to lose the feeling with the practice, with the clinical practice.
Sure.
So I practice physical therapy, manual therapy 1 day a week. So I still have that experience with patients every week, not too much, of course, but every week, one day, and you learn a lot of that, of course, and it's also good for me as a researcher that the things that we develop can be implemented in practice.
Sure.
It's not that I think about something and just throw it over to the clinicians and they
figure it out.
Yeah, figure it out. I need to work with that myself as well, so that's also a good experience, of course. But I think it's an advantage to have different roles because you have different perspectives on the topics that I'm working on.
And now the structure, we're at the IFOMPT conference, but IFOMPT belongs to IFOMPT. I have that correct, right?
Yes.
And you get to act as the vice president of IFOMPT. What do you see as the biggest challenges from that perspective and opportunities for advancing manual therapy on such a large scale? And how does IFOMPT help guide clinicians worldwide to adopt those best practices in manual therapy and patient care?
Yes, I think that one of the biggest things IFOMPT can do is also develop some guidelines, frameworks, as was also done with regard to safety, for example, because it's important that the knowledge is distributed to the whole profession all over the world. I think that's very important. So IFOMPT can really play an important role in that. And of course, growth is also important. So there are many physical therapists in many countries. But IFOMPT is still rather small, so expanding to other countries is also very important. And we are working on that at the moment. So I hope that in the future we can also have more member organizations. So first you start in IFOMPT as a registered interest group, and then you can progress to an associate member organization and then a full member. And I hope that many, and I also had a conversation yesterday about potentially a new registered interest group. So that's very important that we grow, but also that IFOMPT is, and we do that luckily, provide some support to grow from that registered interest group to the full member status, because that can be challenging.
Sure.
But we provide support. So if this also maybe this goes to other people around the world and you would like to join the IFOMPT family, please free to reach out to IFOMPT, because there is support available.
Yeah. And today that distance can never be closed, right? With a phone, you can learn from far away. That's got to feel pretty good to have a global reach with an organization like IFOMPT and IFOMPT.
Yes, I think that's true. So nowadays, with all the digital possibilities, it's quite good. Although we should also think about that this is normal for us,
Right.
but in some other countries, low or middle income countries,
Right.
it's not not normal maybe. So,
Right.
but we are progressing that in those countries as well.
Let's talk about clinical practice and education. You've got extensive experience in both of those areas. We talked about that before. What changes or innovations do you foresee in the future in how we teach and train manual therapists, especially in light of evolving safety protocols, safety first, and person-centered care?
Yeah, so I have to admit, I am not an experienced teacher. So my main role at the university is research. So I'm not a teacher involved in any manual therapy program. But I think things are changing. So the profession is progressing. But I think implementation is very, very important. So we should make sure that that we provide contemporary care to our patients. And to do so, educational programs are very, very important. And then maybe one example is that in the IFOMPT cervical framework for safe treatment of the cervical spine, previously we had that is called positional testing, so VBI tests, and these were frequently used by therapists, and these were deleted from the IFOMPT framework because they don't have sufficient diagnostic accuracy, so they are not really valid methods to use in your practice. But now we also see that still about 60 or 70% of the practitioners use these tests in clinical practice, and that also, although these tests were deleted from the IFOMPT framework, removed from the IFOMPT framework, still about half of the educational program still teaches these tests in their curricula, and that's very strange. So I think education programs have a very important role in making sure that they teach contemporary care, and then of course there's also a role for the clinician to implement it in clinical practice. I think that's very important, and also maybe. Although it's sometimes difficult, cooperation between educational programs, I think that should also be facilitated because they can also learn from each other, and that's the way to go. Don't reinvent the wheel every time, but work together.
Well, I think you bring up an interesting point. When we think of advancing education and advancing care, we think of adding, but what you highlight is sometimes removing the things that we have proven not to be as accurate is just as important.
De-implementation of care is even important.
Yeah.
So we should stop the things that are not evidence-based or don't have added value, because that's also a kind of can be dangerous for the profession, of course. If we do things that are not evidence-based, and then people look at why do they still do those kind of things? So I think that is not a good thing for the profession. So we should also work on the implementation if necessary.
Well said. Let's look to the future again, but in light of your research. As you continue to research and lead in manual therapy, what are you most excited about moving forward? What are things on the horizon? Any upcoming projects or initiative you're particularly passionate about?
Yeah, so because I have so many different roles, it's sometimes difficult to have that perspective, but for me, one of the major things I'm working on, so with regard to the self-management part, we are now working, for example, on the Cochrane review for self-management for lower back pain. It's a lot of work, but that's something that's very important, I guess. And also in the same topic, we also are working on the development of a questionnaire, the musculoskeletal self-management questionnaire, to assess self-management skills in patients, because there's no existing questionnaire on that topic right now. So those are very important topics that I'm working on. I also would love to continue working on the vascular pathologies. We are also now working on a kind of international survey that we have conducted last year, and also presented some results of that. But we want to get it out published soon, of course. So these are all nice things for the future. And then also within IFOMPT, as I said before, growth is very important. But also some other issues we had in IFOMPT, we are now trying to solve. For example, we had an election for the new executive committee in the conference in Basel in July last year, and we had an all-male executive committee. So, and with regard to equity, diversity, that's not really a contemporary approach. So we're also working on that right now. So those are kind of things that are very important. And as you might know, and the listeners might know, that IFOMPT also has some educational standards. We are revising these educational standards. So a lot of things going on also in IFOMPT for the future.
On the horizon. Last thing we do on the show, we call it the parting shot. Is there one idea or one soapbox statement or mic drop moment that we might call? One thing you'd want to leave with the audience to make sure they don't forget?
So I think maybe they don't forget it, but we have a wonderful profession. And I'm very proud to be a physical therapist, and I believe that sometimes we are undervalued. It can depend on the country. I also think we are undervalued in the Netherlands, for example. But don't make that change your opinion of your profession. Be proud of your profession and move forward. And don't look to the past, but look forward to the future. Because I think we have a wonderful future, but we should really work on that.
My parting shot for you, of course, is safety first. Don't forget that.
It's very important.
Nathan Hutting, appreciate you stopping by after giving a keynote
Thank
here
you
at
so
AM
much.
2024. Thanks.